Our next presenter is Mike McLoughlin, the founding director of Walk-In Clinics. The topic of his talk this afternoon is providing better access to primary health care in BC. What do walk-in clinics want? Please welcome Mike McLoughlin.
Well, thank you, everyone. We've had a very, very stimulating day. I'm going to zoom through my presentation because we want to hear from Tom Tyson. He'll be our last speaker, and he's got some really interesting ideas. So let's just take a look at it. What do walk-in clinics want? So if you just want to move forward there, everybody has one in their package, and this is called the Very Valuable Service Report. Does everybody have one of these? Can you bring it out? We had a doctor earlier in the day ask us what was our vision as an association. So if you just look on the last page, the inside last page of your Very Valuable Service Report, you have the principles of Walk-In Clinics of BC. And each one of these principles has as its verb is advocate. So we are here to advocate for walk-in clinics and clinic owners and doctors and staff. That's one of our major purposes as an association. So what are we advocating for? Let's move to the next slide. So access to primary care. That's what we're advocating for. That's what walk-in clinics provide, is access to primary care. And access to primary care has been getting more and more difficult. And as we see, in terms of the percentage of British Columbians that don't have access to primary care through a family doctor, this percentage has been increasing. And this is from the Community Health Survey with Statistics Canada. So it has gone from around 11-12% to almost 18% in 10 years. So these are more and more people in British Columbia who don't have access to primary care. One of the reasons is that the capacity for physicians, family doctors, has been declining. And it has to do with lifestyle changes. Younger doctors are more interested in having a life outside of medicine. And that's an important change in how our system works. So with a smaller panel size, that means they can't take on as many patients, which means that there's more orphan patients, there's more patients looking for a family doctor. So our recommendations in our report, we had 3 recommendations. So the first recommendation had to do with the cap. We were asking government, and we presented this report to the Standing Committee on Government Services and Finance. We asked for flexibility in the cap. I know one of the doctors here says, I'm okay with the cap because he was not wanting to be overwhelmed by all of the work he had to do during the day. And some doctors are okay with the cap, but maybe we could do it in a more flexible way so that we can accommodate the schedule and the lifestyle changes that young physicians have, so that perhaps instead of working 7 days a week or 5 days a week, they can work 4 days a week, but they could work longer shifts and they could see more patients. So why the number, which was 50, why is that the sacrosanct number? Is there a different number that we could be using? So this is something we've been advocating for, is a change in the way the daily cap is administered. The second thing is regulatory review. So there's a lot of regulations that limit access to primary care. And basically, it has to do with capacity, providing that capacity, and we, as walk-in clinic, want to use retiring doctors that are transitioning out of their family practice to provide more capacity in our clinics. But sometimes that's difficult for them because they want to work part-time. But the college sets a bottom as to how much they can work and still be qualified as a family doctor. And so that's a regulation that if they don't meet that bottom, they don't meet that number of hours worked in a family practice, and it's a family practice, not a walk-in clinic. If they don't meet that number over a 3-year period, they will be deregistered from practice. So this is a regulatory situation that can be adjusted, and that could provide more family doctors. And, okay, now I've jumped ahead. Yeah, no, that's fine, okay. So we have, the third thing is nurse practitioners. We would like to see more nurse practitioners working in walk-in clinics. Right now, the government graduates 45 nurse practitioners a year. There's a report out from the Nurse Practitioner Association saying that they should double that to 90 a year. In Ontario, they graduate 300 nurse practitioners a year. So if we had more nurse practitioners as physician extenders, they could increase the capacity for doctors to see more patients in the clinics. So these are 3 reasonable recommendations we made in the report. This is 2 years ago. Now, as you can see in Kamloops and in many of your clinics, how many clinics here have lineups out in front of the clinic when you open in the morning? Yes, so most of you have lineups. Common situation, and it's only getting worse. So the government has said, and they came out with a press release yesterday, saying that we've trained a lot of new doctors. We have new residency positions. But the question we're facing, is it sufficient to meet what is a growing demand for access to primary care? And right now, it isn't sufficient. And it may have to do with system design, it may have to do with how things are allocated, but the reality is we need more family doctors. Now, I'm not sure how they're going to redesign things to be able to provide those doctors so that they can people can have a doctor. But this is a very strong need right now in the province of British Columbia. In response to this need, I met with some doctors who work at the Lonsdale and 19th Walk-In Clinic, and we decided that we would run a petition in their clinic for more family doctors. And we will see on our panel, we have the doctor and the office manager from Lonsdale and 19th, and they will be talking a bit more about the results of that petition. But they've been running it for the last week. It's also been running online, and so we have actually over 500 signatures in the last week. So this is touching a nerve, I think, in the province. Next week, the election starts. There's already been discussion about the family doctor shortage as being an election issue. So it's going to only grow, and the more that we can give voice to the public's desire for family doctors, the more that we can connect with patients that are looking for family doctors, the more people will be able to sign the petition. So what are we doing with this petition? And what I'll do is I'll just, if you have it in your bag, if you want to just take it out and take a look at it. The title of it is Provide Better Access to Primary Care in BC. Really compensating enough family doctors to provide sufficient and timely access to primary health care, not only on weekdays, but also after hours and on weekends. Now, I know earlier, Andre Picard was saying that often in Canada what we do is we just throw more at something to try and fix it. And really, we're not necessarily asking for more family doctors in terms of the actual quantity of family doctors. What we're asking for is that capacity that family doctors provide. So how are we going to increase their capacity? One of the ways we can increase their capacity is by fairly compensating them during the weekends and on the weekdays and in the evenings. So when you pay somebody a premium, they feel that it's okay. Okay, I'm worth it, and I'm going to work that Sunday shift so that I can provide more capacity. So that is one way, without having to increase the numbers, you can increase capacity by just giving people a premium to work after hours. Secondly, reduce or eliminate government red tape, such as daily volume limits, that prevents family doctors from seeing patients in a timely manner while at the same time upholding quality of care and patient safety. So, in the MSP, guidelines, there is a regulation that basically says 50 patients. After 50 patients, the doctor gets to bill 50%, and after 65, they can't bill anything at all. And it's not an exact one-to-one ratio. There's a volume point system that works. The doctors see this as a way of basically, I'm going to work to my limit, and that's it for the day. And that's what happens. And you'll see on the signs, I'm sure you all have them on your clinic. You know, the clinic will close when it reaches its capacity. So if we wanted to increase more capacity, we can do something about those volume limits. How can we change the way that those are calculated so that doctors are not having to be worked off their feet, but at the same time, there's more capacity for access to family care. And the third thing is engaging with family doctors, allied health professionals, walk-in clinics, and patients so as to provide access to primary health care closer to home in people's neighborhoods and local community. And that's the story I hear over and over again. Somebody has a family doctor. Like we have people in Kelowna that can't find a family doctor in Kelowna that moved there from Abbotsford, and they drive to Abbotsford to continue seeing their family doctor. This is happening all across the province. And it's such a ridiculous thing that people would have to go long distances to access care. We need to have that change. The goals of the petition is to show support for family doctors, educate the public about the need for more doctors, and we want to get 300,000 signatures. And the reason we have that number 300,000 is that's the most recent number from various different medical bodies of people that are actively seeking a family doctor in British Columbia. 300,000. Now there's more than that don't have a family doctor, but that's the estimate of that are looking for a family doctor and can't find one. 300,000. How are we going to get to 300,000? I know it's a big get. Okay, so like we're doing in the North Vancouver Clinic, there's an actual station in the clinic where people can sign the petition, drop it into a box. No pressure, just it's there, it's available, and they can do it if they want to. The other option is to use a poster in your reception that points to people's an online petition, and that's where we have an online petition at change.org, and that online petition, it's more social marketing type. It's much more friendly that way. So you can share to your friends that you've signed the petition, encourage them to sign it, and so on. And that's actually where we've got the most numbers right now, is from the social media of that particular petition. So there's a direct. You can have the petition in your clinic, or there's an indirect if you want to just notify patients that there is a petition and this is the address they can go to online. So we've been getting at the clinic in North Vancouver an average of 100 signatures a week. So in a year, it's logical that we could generate 5,000 signatures. If we had 60 clinics all having their petition in their waiting room, and we have over 300 clinics in the province, if only 60 of those clinics had that petition going. In fact, here right now today, we have over 100 clinics represented based on the various different groups and corporate entities. So it's not unreasonable that we could recruit 60 clinics, and at 100 a week, we can get 300,000 in a year. And we're not looking to have an intense campaign for the petition. We're actually just basically giving an opportunity to educate the public and have a way of people can voice their concern about not having a family doctor. If we had 120 clinics participating, we could do it by November 1st. And the reason that's an important date is that's the date where the Government Services Committee finishes its deliberations and makes its recommendations to the new government about what's going to happen in the budget. So if we wanted to influence what was going to happen in the budget for 2018, that would be an important date to have the 300,000 signatures. Now, you're thinking, okay, how are we going to present this? It's just going to be one presentation. No. What we're going to do is we're going to ask the clinics to run it during the spring, summer, and then in the fall, we'll gather the petitions. You know, it could be 500 from this clinic, could be 1,500 from that clinic, and we'll go to the MLA and we'll say, hey, we have a petition from your constituents, and you, as an MLA, have a responsibility to inform the legislature of this petition. Each MLA has a responsibility to stand up in the legislature and read the petition. And that is something that can happen during the fall sitting of the legislature. So we could conceivably have 60 MLAs reading the petition over the period of October 1st through to November 1st. So it could actually get a lot of play if we had a lot of MLAs reading the petition. So that's how we're raising awareness of our need for family doctors, how we are wanting to see the government take some actions to change things, and what we're doing as an association. And that's what associations do, is that they advocate for the interests of their members. We are, having challenges. Our clinics are closing, and that's because of the physician shortage. And this is a way in which we can, as an association, make a difference in recruiting more doctors and in addressing that whole physician supply. So, mark your calendars for next year's conference. This is what we're planning for 2018, and hopefully we can have a good report as to what has happened with the petition and more capacity for your clinics to provide more access to primary care. Thank you very much.